I've had the privilege to come here to Springhill Medical Center to enjoy and be part of the reputation that this place has. It's a comprehensive hospital that provides just top-notch cardiovascular care. This hospital has been on the map nationally for an awful long time. We have a comprehensive center where you can have a need for care and get your care expeditiously.
At Springhill, we use a team approach to the diagnosis and treatment of a patient. They are initially seen by a cardiologist and oftentimes in conjunction with a surgeon. They can come to the catheterization lab. We can take pictures of their heart and do physiologic testing to determine their condition, and in conjunction with the cardiologists and the surgeons, come up with a plan for treatment.
Our goal is to try to treat people as in the least invasive way possible. We have come a long way in cardiology and have now got to the point where we can treat a lot of the diseases and a lot of the heart ailments with a single night in the hospital and having patients go home with just a Band-Aid instead of a large scar. We incorporate the electrophysiologist, we incorporate heart failure doctors, we incorporate interventional doctors that take care of your heart arteries, and we have structural doctors. We also have brought in some of the best cardiovascular surgeons.
By having senior surgeons on campus available 7 days a week, 24 hours a day, we're able to bring some of our lifetime worth of experiences to our patients. We're able to take tools and techniques that we've used other places and apply them here.
The care has become more of a team approach, where a person that comes in is going to be treated and seen by multiple different doctors depending upon their needs.
When you go back to the history of the cardiovascular program here at Springhill, they have been creating science here as part of some of the landmark studies in structural heart disease.
There's been a lot of changes in heart surgery in the last several years. One of the greatest evolutions of cardiac surgery in my time has been the TAVR procedure, transcatheter aortic valve replacement. And that has truly revolutionized aortic valve treatment.
One of the areas that I think we've really advanced on heavily is in the realm of heart failure. Heart failure with a leaking valve used to be a death sentence. We know that repairing the valve resulted in worse outcomes.
So there were many people with mitral valve disease who were simply too frail and too sick for surgery. So they developed a procedure called the mitral clip.
With the mitral clip, we actually can now repair the valve, give a person a longer period of time to live with a better quality of life and less chance of having to go back to the hospital. We have moved from just doing the procedures to actually training other facilities in how to do the procedures. And we're very heavily involved in clinical trials and research that's now going on to advance the modalities and bring a wider scope of care to the people here in Mobile.
What we do here is we emphasize the continuum of care. It's a journey. And so you get your treatments. We want you to participate in cardiac rehab. We want you to do lifetime things because, quite frankly, we don't want you to come back to see us for a new emergency related to your heart. We want to have that treatment last you an awful long time.
In cardiac rehab at Springhill, we do a variety of things that makes the patient more comfortable. So the patient is in an environment where they're not just in a generalized fitness facility. They're actually in a department of the hospital that is staffed by nurses and respiratory therapists.
So the important reason to have a program that's healthy and viable here is so that the people in this area can have access to early intervention when they have acute coronary events.
It's very easy as a practicing surgeon to be able to be close to the patient and to be timely for patient needs. We are a regional medical center that's available to give cutting-edge care in a small town environment. It's a really cool thing to do.